was already a fiery debate, but this week a couple of school districts really poured the gasoline on it. It's all over sex and our schools. First, a school district in Maine decided that they would allow 11-year-old girls, let me repeat, 11, would get birth control pills without parental notification. That one sure got national attention. And then in suburban New York State, 8th graders coming home from a school health fair, you know, where they used to teach you about bumps and bruises, well, they brought home these graphic pamphlets, and it was all about sex education. The school apologized, but some parents are so angry they want their principal to step down.
Home and school issue here, and I choose to educate my children about sex and other moral matters. I want my school to do a good job of teaching math, English, etc.
He apparently did nothing. In fact, he has not explained himself to this day. He is not responding to emails.
Well, joining us now, Cheli, Cerra, a school principal, in fact, and the author of the School Talk Success series, and also Dr. Seidel Berlin, an adolescent expert at St. Luke's Roosevelt Hospital Center that's here in New York. Thanks for being with us.
Thank you. Thanks for having me.
You know, I'm glad, Seidel, that our kids in middle school are reading, but I'm really confused about whether or not they should be reading this graphic material.
Well, this is material that I can't defend or not defend. I wasn't there. I don't know whether the pamphlets were appropriate. But if they're educational pamphlets, then the school needs to come in and see whether they're developmentally appropriate for those kids and back it up with an effective sexuality, puberty education program.
But Cheli, if the parents feel that it's not appropriate, are we losing our say in schools over sex education?
Well, as an educator and as a parent needs to be involved in such issues, and many instances they do have to give parental consent for sex education being taught to their children at school.
But that's the catch here, and let me ask you about that, Cheli, because what happens here is you write the little permission slip for your kid to be treated at the health center if necessary. What you don't realize is they can also get birth control pills and patches at 11 years old, and you don't get another phone call, Cheli. Is that right?
No, that's not right. I think they need to readdress that, and parents need to be brought in. They need to be made aware that these children are having sex or are thinking about having sex.
Well, Cheli, I'm glad you and I are on the same page with this. I think this is a clinic that is a medical clinic. It's doing its job. Parents need to be more informed when they sign up their kids. They don't have to do that, but the school is trying to work in tandem with the kids that are at risk. And it's not just about 11-year-olds. I think the hype here is 11. We have middle school kids who are 12, 13, 14 years old.
Or even younger, I'm sure.
Or even younger, yes. And if they are having sex, we don't want them to be having sex at that age, but if they are, they need the support and help of caring adults like us.
But Cheli, these are kids even 9 and 10 years old. They haven't had their first kiss. They haven't been out on their first date, and we're providing patches. It's hard enough, Cheli, for parents to talk to their kids about sex. For some parents, is this a better option?
No, it's not. I think we really need to bring in place some counseling, emotional counseling. These children should not be having sex. I really have a hard time as a parent thinking that my 11 or 12-year-old is involved in sexual activity. We need to educate that sex at this time, children should not be having sex.
All right, but I guess the doctor is saying as well, you know, get with it, it's happening, and maybe the parents should talk to their kids more about it.
Yeah, I'm saying let's be realistic. Let's not jump to conclusions. Most young people at 11 are not having sex. But they are eager for the information. They're in the throes of puberty. They need it, they desire it, and they...
Seidel and Cheli, I'm against a hard break. I do apologize. It just gets tougher and tougher to be a parent, but I'm glad you presented both sides. Thank you very much.
You're welcome.
Thank you, Jamie.